is News 8 Now.
Here we go on a cool day like today, and it is going to get cold tonight. We're reminded summer is a bit over. Tans have faded. We see the damage done now from a little bit too much sun. More people are getting injectables and lasers to reduce wrinkles and sunspots. And there's one laser that not only treats the face, but the neck and the chest and the hands as well. Fraxel made big news when it first came out, I think about a year and a half, maybe 2 years ago. It's improved a lot since then, and plastic surgeon Dr. Jay Burns is back to fill us in. Good to see you, Jay. Have you on the show. Yeah. Explain the new Fraxel. Can I call it the new Fraxel?
Yeah, you know, the Fraxel has been changed a little bit. It's a fractional resurfacing. It's not as downtime as the laser resurfacing that I've talked about on the show.
Right.
So it's kind of in between. It's not like totally no downtime, but a little. But what this new...
it's new and improved, though, is what we're saying.
Yeah, it really is. And
is it a big leap?
I think it's a big leap. You know,
wow.
As a laser kind of geek, you know,
yeah.
They came in and showed me the physics of it, and what it does is it allows you to get some of the deeper wrinkles that it really couldn't do before, and it also allows you to tweak it. And I won't get into the physics of it, but if you just have superficial brown spots and some mild texture changes, it really does make a difference for those, and the downtime's not as much, but if you want to go deeper, it can do that. So it gives us more choices and individuality, and it's what, you know, we talk about a lot.
Jay, what's she got blue on her face?
Yeah, well, that's one of the great things about this is because it only fires on the blue. So the blue's kind of a pain to put on, but the thing is it's very safe because the laser literally won't fire off the blue, so it will only go where you put the blue.
Oh, and what kind of blue is that? Is it
it's just a dye.
An oil? It's a dye.
It's literally a type of food color mixed with some stuff. Because the laser has been designed to only see blue. It's really neat technology because it's really safe.
Wow. It's kind of fascinating to watch, and you're saying the new one is better and newer and improved and upgraded. Yeah, you have several before and after pictures of this laser being used, this Fraxel being used for different treatments. Explain what we're seeing on the left and the right.
Those wrinkles around the eyes there, and you know, it's just kind of nice to be able to do that. You have a couple of days of downtime as opposed to 2 or 3, 4 weeks, and so a lot of people find that to be very nice. You know, baby boomers kind of like to have it all, and so be able to do that is a very nice touch without having a lot of downtime.
And you're not tricking us with this photography. You never do that. This is the real thing. I love that.
Yeah.
You know, this is not a magazine ad that's tricking us.
And this is a great, yeah, right, this is not the stuff you put on with a cream and it's done over the night. But the point is that it's, you know, this is a great result. Not everyone gets great results like this, but it's kind of exciting to know you can get some of those results.
Okay.
Fraxel's become kind of our #1 choice for acne, and acne patients are just desperate. And, you know, that's really a nice improvement. And you can't ever get rid of make acne skin totally normal. But, you know, to have some improvement like that with minimal downtime, boy, it's been a really nice thing for the acne patients.
Boy, that is dramatic. That's very dramatic.
Yeah, that's one of my patients.
Wow, lines on the forehead.
And see, the thing about it is, you know, we've talked about intense pulse light or photofacial, which a lot of people know about. It might help that brown discoloration or melasma that women get, but look at the wrinkle improvement. That's just something that IPL or photofacial has not been really able to do. So Fraxel takes it a little bit more, a little bit more than what photofacial will do.
Okay, now the neckline here.
Yeah, if I had this laser and I couldn't use it on the face, I'd still use it and buy it for my practice just because it'll help the neck and chest and arms. You know, a lot of women when they get older, for years and years in my practice, they've said, you know, they put their shoulders together and say this crepiness on my chest and I can't wear low dresses. We could get rid of the brown with the photofacial and IPL, but we couldn't get rid of or help this crepey neck, and it really does help that quite a bit.
Very dramatic. And now the hands.
Same thing, Sarah. You know, you can get rid of brown, but, you know, rejuvenating the hands is a really wonderful thing, and Fraxel will allow us to improve that. Again, Gary, I want to be honest, you know, these are great pictures, and you can get somewhere. You know, everybody gets somewhat of a result. We talk about these non-ablative or these no downtime procedures, and some of it's bunk. You know, these contour threads that get, and that's been, plastic surgeons are pretty much discounting those at this point. It's kind of a $4,000 Botox. It lasts 6 months and it's gone. But this has stood around for a couple of years. They've made some improvement, and I just, you know, I thought it would be a good thing to talk about after the summer. It's kind of a real deal.
A couple of general questions. How many treatments before you see results? Is it not just one? It can't be.
No. It's a series of treatments. You know, anywhere from 3 to 5 treatments.
Okay.
You begin to lay collagen down from the stimulation, so it takes about a 2 to 3 month delay in terms of seeing that. So you treat.
Will you do it once a week?
Now you do it every 2 to 3 weeks.
2 to 3 weeks.
You know, you can go 4 if you're on vacation or whatever. You know, there's no long time, but you can't do it more than about every 2 weeks.
Is it expensive?
Well, it costs a few $100s to a few $1,000s, depending on if you're doing a small area of acne on the face or whole arms and chest. Yeah, so it varies.
Okay, and you said 2 to 3 weeks at least between treatments. Now, how long do the treatments last?
Treatments for a full face, probably 20 minutes, 30 minutes.
It's pretty short.
Yeah, it's pretty short. But you are bruised, you are swollen and a little red for a day or two. You know, I see people eating at restaurants. I know they got a Fraxel yesterday. But
hey, there's a Fraxel patient.
There you go.
Nice to see you, Jay.
Nice
Always good answers and straight up front. For more information on Fraxel or other cosmetic procedures, you check out Dr. Burns' website. It's a good one. It's drjburns.com. Brenda, Amy.